I'm Meshal Malik and you're watching Indus Special. Countries like Australia, New Zealand, and many across Europe are now bracing for a second wave of COVID-19, while places like Hong Kong are taking measures to prevent a third outbreak. On today's show, we discuss whether most countries, if not all, should prepare for another outbreak after infection rates slow down initially. We also discuss how exactly an outbreak during the winter season will look like. Joining us for this conversation today is Dr. Unutmaz, who is a human immunologist at the Jackson Lab. He joins us from Farmington. Also joining us today is Professor Benjamin Neuman, who's a professor and chair of biological sciences at the Texas A&M University. He joins us from Texas. Thank you both for joining us and welcome to the show. Dr. Unutmaz, I'd like to begin with you. Now, when we talk about how many countries who initially got rates under control are now bracing for a second outbreak, is this pattern inevitable for most, if not all, countries, that they will have to prepare for a second outbreak?
Yeah, this is quite unfortunate, but we have to look at the data, and it really coincides with what's called the normalization or the new normal. I think the countries who are doing it correctly, mainly, making sure that everybody continues to wear masks and that the tests are done properly and social distancing. When they do that, actually, so-called the second wave seems to be very minor. Whereas the other countries, in particular United States of America, where parts of the country opened without such controls, is probably a continuation of the first wave that's showing a drastic peaks.
All right, so
but I would say that it's not inevitable, that it can be controlled.
It can be controlled. Can you expand on the point a little more? And then I'm going to also take this same question to Professor Neuman. How can we avoid a second wave? You're saying that there needs to be precautions and practices in place. But even if we look at the case of China, in Beijing, we saw another spike in cases, even though we know that the measures taken there were pretty drastic and strict.
Should look at this as sort of a wildfire. If you will have small fires coming out, and if you're prepared for that, you will squash it. I mean, in China, they did see this, but they took drastic measures immediately, and it didn't really spread. But if you let the fire go on for a while, then it becomes very difficult to control, as we see in parts of the United States. So I don't think that we will eliminate the virus anytime soon. So we just have to be prepared to adjust our new lives, which is not going to be the same as it was 4 or 5 months ago. We just have to continue this until we have very, very effective vaccines and treatments.
Right. Professor Benjamin Neuman, on another note, but just taking this one step further, when we talk about the first wave ending, or if not ending, but cases going, declining, decreasing, and that window of opportunity you have in order to make sure you implement certain mechanisms in place to avoid another spike, that brief window you have, what do you think should be done in that?
I think Dr. Unutmaz actually makes very good points. There's nothing inevitable about the spread of coronavirus. It can be controlled with fairly simple public health and readiness measures, things like requiring a mask when anybody is outside and limiting the amount of time that people are together under the same roof, breathing the same air effectively. With controls like that, which can be implemented almost instantly. At the start of this, the sort of homemade and readily available mask industry was not a thing that really existed for a lot of countries, like America, like many parts of Europe. Now we're in a new situation, and this is the new normal. Masks are widely available, masks are cheap, and masks are a thing that really need to be worn. There are ways out of this. I don't think there's any particular point where it is absolutely more critical than others. I think it is critical that the masks be worn and the public readiness is maintained constantly until this virus is gone. And only at that point can we start to actually talk about relaxing. The idea of relaxing any restrictions while there is still some virus circulating, we've seen time and again in different countries, is a very bad idea and is a mistake in the making.
Right. Now, you're talking about the fact how important masks are, and we need to implement all of this. But I feel like, and especially when we look at the case of the United States, that this is something that needs to be worked on, the public discourse surrounding these things, which countries for so long, and at least up till now, and continue to do so, have failed miserably at creating one discourse which resonates with all, which sets out guidelines very clearly. How much more room for improvement do you think there is in that?
So for one message to come through clearly, the one message pretty much has to be coming from the top. That's something that hasn't really happened, not just in America, but in several countries.
Right.
The UK really struggled with this. And we're seeing problems with this in India, in Brazil, in all the countries where the virus is growing out of control. It's a thing that needs to be done, but depending on the country and depending on the mindset of the people, this can be quite difficult. And I think this is proving to be the biggest challenge so far in knocking out COVID-19.
Right, I'm going to come back to you, and we're going to discuss more of the challenges that seem to be up against us ahead. But before that, I want to go to Dr. Unutmaz and talk to him about this idea and this notion that surrounds the first wave, that once it's over, enough people will build immunity, and that's why the second wave won't harm them as much. And now we have this new UK study that says that immunity will probably last for 20 to 30 days until it starts wearing thin. How much do we know about immunity, and how much can we say for certain that after the first wave, it gets easier?
Yeah, this is an extremely important point. Actually, we had a study as well from Jackson Laboratory that we just published as a preprint about a week ago. We developed our own antibody tests, which are extremely sensitive, looking at both the levels of antibodies and their neutralization capacity, which is very important because if you want to get rid of the virus, you have to show that they actually neutralize the virus. And we found something concerning and similar as the UK study. It wasn't as short as they found it, but after about 2 months, the antibody levels were going down quite significantly. And by 3 months, they were very low. And if that trend continues, means that, after 3-4 months, you're going to be potentially exposed to the virus again. There are not many such cases of reinfection yet. There are some anecdotal cases showing up, but not enough time has passed.
Right.
And we have to remember that antibodies are not the only mechanism. But this danger is out there. After 6 months this fall, we might see a second reinfection wave of those who have already been infected, and potentially that could be even more dangerous.
Right, that's very alarming. And as you say, potentially it could be more dangerous. I want to dig deep into that a little more. How exactly? Because a lot of reports come out and say that the body will have memory immune cells as well that will be able to better fight off that virus.
Yeah, that's true in general. But this virus is actually causing, there are still things that we don't know, and it's causing an overreaction of the immunity. So what we found, for example, the patients who were in hospital in ICU had about 100 times more antibodies than outpatients. So clearly their immune system was in overcharge. And so we're starting to think that that could actually be responsible for some of the pathology. I mean, if you have so much of your army, sending out missiles and firing, you're going to damage your organs. So that means that those people are unable to control the virus despite such a potent immune response. And if they see the virus again, you're going to amplify on top of that. So that's the first worry. The second worry is that, we're going to have the flu season starting soon. And, having two viruses at the same time, we have no idea what will happen. It might be a little bit better, but likely that it's going to be worse.
Right. Professor Benjamin Neuman, that very important point that Dr. Unutmaz brings up, that the flu season is approaching, and that's why people are so wary of winter coming, that infection rates will increase, and then you're going to have a flu also circulating around. What preventive measures are there in place, and do you think this is the time to invest more and more in flu shots?
Yeah, flu shots are always a good idea, and I like that. But I think going back one step, there are a lot of people who have, right from the start, tried to compare this coronavirus outbreak to the flu. And we don't know that that's a good comparison. Time and again, people have thought that weather is going to make a big difference, either that the heat or that the cold is going to cause a rise in the virus. And the virus really doesn't seem to care. It does very well in cold places and in hot places. It's more about person-to-person contact. We should probably be talking about this virus not in terms of the flu, but in terms of something like polio, which will kill a small percentage and cause some kind of debilitation to an even larger percentage than this. And the comparison with something like polio virus is actually fairly stark. The COVID-19 actually kills about 10 times as many people. So while the flu coming is potentially a complication, I don't think we can count on this to impact coronavirus in any particular way, except that it will be another complicating factor, potentially making it a little more difficult to diagnose without a test anyway, who is sick with COVID-19 and who isn't. And really, this is something that can only be measured with a test. And so testing is going to be critical, and we have to maintain the testing levels that have started to be built up in a lot of these countries in order to be able to weather the coming storm this winter.
Right, but Professor Neuman, now to that point of being so imperative, there are countries where we're seeing falling testing rates as well as infection rates fall. Do you think that's a good idea?
Falling testing rates are not a particularly good idea, but I think the readiness is probably the key, because surveillance, if we can do a lot of testing as surveillance, that is really going to help with trying to catch up to where the virus is. The problem is, and the reason why we have these spikes that are happening in countries that have more or less knocked out the virus, is that somewhere there'll be a little bit of the virus that's, like one of these little tiny wildfires, still just smoldering, and then it'll burst back up. And it takes a while. It takes something like a week to 10 days before you can reliably get a positive test from one of those tests. And by that time, the virus isn't just in the person who had it, it's already spread. And so, yes, testing remains our best weapon against COVID-19. And I guess the nice thing is, when COVID-19 is extinguished in a country, that country can theoretically send some of the people who are trained in testing some of that equipment out to other countries, because as long as there is any SARS coronavirus 2 in the world, this is going to be a problem for all the rest of the world. Nobody's safe until this thing is gone once and for all.
Right. I'm going to come back to that point that you mentioned here. But Dr. Oz, when we're talking about, and the analogy that you've drawn and Professor Neuman has referred to as these being little wildfires that you need to control, when we talk about a lockdown being imposed and for a certain duration, which one would assume everyone who has this virus would have recovered from it, and then countries, for example, like New Zealand, Australia, they begin to open up, they still have many testing procedures in place. What do we know about how long the virus actually, in fact, lives within the body? How long can it actually become a wildfire, even with all of this that is happening? Because it still seems to be a very confusing situation.
Yeah, I think you described it correctly. It is a very confusing situation. And as Dr. Neuman mentioned, this virus is very particular. There's still things that we don't know. But I will give you one example how this virus can actually hide. And that's in Wuhan, where it already started. As you know, China locked down Wuhan for more than 2 months. I think about 2.5 months. About 50 million people in that region were locked in their houses. And that you would imagine that if the virus only survived for about 2-3 weeks, that this should eliminate all possible viral transmission. However, recently, they actually tested every single individual in Wuhan, I think about 9-10 million tests. And they still found about 300 people who were infected with the virus and who were asymptomatic. So somehow, in some people, it could be rare, 1 out of 1,000, the virus could potentially persist for a very long period of time. So we still don't understand that, or that it could be transmitted through routes that we don't quite understand. For example, we know that it is somewhat airborne. There was another case in China where one person used an elevator and there was no other person in that elevator, but another person who used that elevator got infected, and then that person eventually infected other people, and so on and so forth. So it is a very peculiar and particularly infectious virus. So I don't think that we will completely eliminate it, but if we continue these measures of extensive testing and mask and so on, I think the small fires will be manageable. That's the best that we can possibly do, I think.
Right. Now, Dr. Unutmaz, I think any conversation regarding COVID-19 would be complete, or we would have done justice to our jobs if we did not bring up the essential question, which is when will we have a vaccine? Now, the Moderna trials in the United States seem to be promising. How long would it take for a possible potential vaccine to come about, and for that vaccine to, in fact, reach so many countries in the world?
I think this is an important question that everybody keep asking. Here's the issue. I looked at the data from Moderna trial and before that Pfizer trial. In fact, the good news is that it's very easy to induce an immune response to this virus. Pretty much all the vaccine trials in humans so far are inducing very potent antibody responses and T-cell responses. And you can see that in the Moderna trial, so everybody is very, very happy about that. But here's the problem. There are two things that we don't know. The first is that it appears the Moderna vaccine is actually inducing quite significant amount of side effects. I mean, they call them mild to moderate, but in 45 people, more than half of them showed, chills, fatigue, pain, and in some cases rather severe. Now, consider that you're going to give this vaccine to hundreds of millions of people. So to me, safety has to be priority. You have to absolutely assure that there's no side effects or extremely minimal, because then you're going to have a massive backlash to the vaccines. The second point we don't know, as we talked previously, although the antibodies and the T cells and all this immune response looks very good initially, how long will that persist? And what age groups that will work on? The elderly who are more susceptible, are they going to be also protected with these vaccines? So there's still unknown questions. I have no doubt that we're going to generate or develop a vaccine to this virus, but I don't think it's going to happen in the next few months. We still have a long way to go to ensure that it's going to be a safe and effective vaccine.
How many months precise do you put that time duration in?
I don't foresee any path that before 2021, early 2021, that we're going to have a vaccine that we can start to apply to, or very, very earliest at the end of the year to a selected group of people like healthcare individuals, those who are under risk. The mass application of the vaccine, which will require 1 billion doses to be made and distributed, and so that's probably late next year or middle of next year. So this would be a miracle to develop a vaccine so quickly. Remember that the shortest period that we developed the vaccine was 4 or 5 years. Maybe with this might be shorter, but we still have a time to go.
Yeah, we're crossing all fingers that it will be shorter time than 5 years. Professor Benjamin Neuman, just one last question from you, and it goes to what the doctor just said here, that the safety of this vaccine or whatever vaccine that comes up is mandatory to ensure, because then there will be a backlash. We already know that there is a huge amount of people who are vaccine hesitant, and this was also labeled as one of the top threats by the World Health Organization in 2019. What more work do we need to do in order to bridge that medical information gap?
That is a very difficult question, and I don't know that any scientist has come up with a good answer to that. But I think you are correct to identify this as a major risk in terms of the widespread use of a vaccine should one become available. We're very much hoping that vaccines like the Moderna or the Oxford vaccine are actually going to work well enough in larger trials. But I think there's a trade-off with a lot of vaccines. The harder they hit a person, the more side effects they cause. In general, quite often, the stronger the immune response. And so it's going to be a question of trying to get that balance right when you don't know exactly what's going to be going on inside the person that you're giving this to. You have to essentially go in blind, and there will probably be some side effects of any really effective vaccine. It's unfortunate, but for the greater good of the rest of the world, it's probably something that we just have to absorb.
Right, but isn't there an urgency to deal with this issue of the anti-vaxxers or those who are hesitant? Because if we don't begin to do that right now, it might be too late once we do have a vaccine.
This is true, and I guess what people are hoping is that once the technology is available, then this will sort itself out. You go back in time, and there were lines around the block to get polio vaccines. It was very much at the front of people's consciousness. Same thing with early flu vaccines, same thing with a lot of vaccines. I think if you have a vaccine and it's available and people see what happens when you don't have the vaccine, I think they will come around. And if not, vaccination is potentially, in the very, very long term, a way that we can actually at least approach herd immunity. I don't think we can do it through infection, but vaccination at least has a chance.
Right. Dr. Unutmaz, just before I end this, that point there that hopefully people will come around. Do we need to do more for it? Do you agree that they will come around? Because for us to have any chance of herd immunity, majority of the population has to be vaccinated.
Of course, I agree on the last point that you need to vaccinate at least 70-80% of the population, maybe even more for this virus. Unfortunately, I'm not that optimistic that the people will come around because, I mean, look at the masks. Something as simple as putting a mask is an inconvenience to millions of people who still refuse to use it. They complain that it's a little bit too hot, they can't breathe properly, and so on and so forth. So when you start to have significant, even though they're not serious side effects, that will potentially deter. I mean, I agree that there will be millions who will line up and get the vaccine. The problem with vaccines is that you gotta have majority of the people vaccinated. Otherwise, it's not going to be as effective.
Right. On that point, thank you so much, Dr. Unutmaz, for joining us, Professor Benjamin Neuman for joining us. We're just going to have to wait and see how matters unfold on the point of the vaccine, and we're going to continue to cover this issue and this developing story. We're going to go for a short break. When we return, we're going to have another story for you. Stay with us. Welcome back. Now, as the new school year approaches all around the world, the major question is how to proceed further. The question becomes especially complicated when governments push for schools to reopen. On today's show, we focus especially on primary schools and what the cost is of keeping them closed and what will happen if you open schools during this time. Joining us for this conversation is Mr. Curtis Lawrence, who's the executive principal of Idea Bridge, an elementary and middle school. He joins us from Baton Rouge. Also joining us today is Dr. Jack D. Singer, who's a consultant pediatrician and senior lecturer in child health at Imperial College School in London. He joins us from London. Thank you both for joining us and welcome to the show. Dr. Jack Singer, I'd like to begin with you. Now, according to 1,500 members of the United Kingdom's Royal College of Pediatrics and Child Health, continued school closures are scarring the life chances of a generation of young people. That's a very, very strong statement. How do you see this? Are school closures, in fact, doing more harm than good?
Yes, it is, but you have to take the risks and the risk-benefit analysis. And one of the things about opening schools is that one size doesn't fit all for all these schools. And so for each school system or school district or even individual schools, I think that the common sense rules that apply to, say, a nursing home situation actually applies to the schools also, where you have social distancing, if possible, the hand washing and sanitizing use, and keeping the children. And the main thing really with the schools is the children, and some new studies have come out, about 20 to 30% are asymptomatic who are positive for PCR, for the virus. So they're shedding the virus, but they have no symptoms. This is true of adults also, which is a huge problem for schools. And the problem is not so much the children, the problem is the adults that they're in contact with, namely their teachers, the ancillary staff, people who are cleaning the schools, administration staff, and in addition, their parents and also elderly parents or grandparents who are within the household where they come home and expose them. I think most people know the old scenario is that when a toddler comes home from a school who has a cold, the parents are in bed for about a week. And this is quite true of almost all viruses. And this is not any different from COVID-19, except the consequences are much more severe.
Right. Now, as you hear that there is, of course, a context to be kept in mind when schools or administrations say that we're going to reopen our schools, and you being a signatory of that statement that said that being outside of school really scars children. Now, keeping that entire context in mind, I do want to talk about what the cost is and mental health cost and other costs you see for why you would say schools that can practice social distancing but will have still a risk of there being a virus spread should open.
Well, I think that the issue with children is that we know that there are a lot of, there are enormous benefits from schooling, including social intercourse, their growth and development, education, everything. The thing about the schools or the elementary schools in the US, primary schools in the UK, is that the fact that most of the children are asymptomatic anyway. So it's a different scenario when you're dealing with adults, where the adults who have the virus and are sick, and it's a serious illness. With children, it's not. In fact, the younger you are, the less chance you have, A, of getting the disease, and if you do have it, you have no symptoms.
Right.
So schooling is essential. Sorry, go ahead.
Right. Dr. Jaxinger, stay with me. I want to come back to that point you mentioned about young children being asymptomatic and how much we know about that for sure up till now. But I'm going to jump to Mr. Curtis Lawrence and talk to him about this. Mr. Lawrence, now you're talking to us from Louisiana. There's almost 84,000 cases there of the coronavirus. Given the context, given what the doctor just told us about what needs to be done in order to open schools, do you think your school is ready to open?
Yeah, that's a great question. So one of the things that we are doing at our school for school opening is our operations staff has gone throughout the school, measured the distance between the desks. We've put on the desks shield guards or sneeze guards, if you will, plexiglass around the desks, and requiring our adult staff to wear face masks as well as our children. We've also installed additional hand sanitizing and washing stations. And as far as water, we've installed more devices that you can fill a water bottle versus having to drink directly from the fountain. And so following all of those guidelines and the social distancing, we've created a schedule to accommodate that so that children can come back to school. And one of the things that we found is we also sent out a survey to our families, and about 70% of our families said they want their children back in school. And so our accommodations, the things we're doing, are to accommodate the majority of our parents who want their children back in school.
Right. Now, Mr. Lawrence, realistically, when we talk about elementary school children, we know that seldom do they really cover their mouths when they sneeze or they cough. And it's most likely that they'll come home exchanging masks with their friends, doing all sorts of things that children do, realistically expecting all these measures to be enforced for a sustained period of time. Are you optimistic about that?
So I know, especially when we get down to our kindergarten, first grade babies, and they love touching and they sneeze into their hands and touch. With those, that's something that I won't say it's impossible to do. And so our class size, which is normal 30, we've cut our class size in half, and so that our scholars are sitting at least 6 feet apart. And I believe also with our desk, all of our desks having sneeze guards, even if our kindergartners sneeze, it's going into the sneeze guard if their mask is off at that time. And so those are the measures that we're taking based on guidelines from a health department and CDC, so that the school can be as safe as possible for our adults as well as our children.
Right, stay with me, Mr. Lawrence. I'm going to Dr. Jack Singer. Dr. Singer, now the evidence and all the information we have about how much the coronavirus impacts children, we have gone down into the 6th month of this pandemic, but we need to keep in mind that schools closed off very early on. So the data that we have, would you say that it's conclusive in how children are impacted by this? Because for as long as we know, at least 4 to 5 months, children were in their homes. They weren't really exposed to the virus.
From a medical point of view, they've done very well because we've seen almost a complete drop-off in the usual childhood illnesses that present to the pediatrician in the outpatient department, the coughs, colds, tonsillitis, fevers, diarrhea, things like that, simply because of the isolation. The downside of that is their social development. And it's more important from the children up to, say, age 5, 6 and onward. It's important in all stages, but especially in the young toddlers, because this is where they learn socialization skills, how to get on with their cohorts and their colleagues, and this is where the majority of learning actually takes place. So that's important. The other thing I just would comment on, that the CDC guidelines are nothing more than guidelines, and they're what you should aspire to. However, you should realize that the schools can only do so much because they have to work in the context of what's happening around them, which is an unchecked pandemic involving adults. And that's the issue, because you can't ask the schools to do all these things that were just outlined by my colleague in Louisiana without looking at it in the total context of what's happening on the outside world around the school. So if there's no effort, or if there's a raging pandemic among adults, these measures aren't really going to be that sufficient. I mean, in this country, for instance, once you can get the R level, the reproduction level of the virus below 1, that at least gives you a chance to institute all these measures. I know in the U.S., the federal government, President Trump specifically, cited countries like Germany, Denmark, and Scandinavia, excluding Sweden. These countries have actually gotten the adult pandemic under fairly well controlled. And right. When they talk about hotspots flaring up and dealing with this with trace and track, or track and trace, that's fine. But this doesn't apply to the U.S. at all, because at the U.S., the epidemic is still totally out of control in the adults. In this country, it's pretty well under control, and we can institute these measures. Right. And a lot of primary schools, what they're doing is that instead of splitting the classes up, the classes of, say, 30, 15, and 15 are bubbles. And so that outside in the playground, the two bubbles play with each other, and they have an open door policy between the two classrooms of 15 and 15. And that's a much more pragmatic British approach, I guess. Right. To the situation. The other thing that we're developing here is a schematic to make the school as COVID-free as possible, which is testing the staff on a regular weekly basis and testing the children.
Right. That's a very important. Dr. Jack Singer, since I'm short on time, I want to take all the points you've mentioned here and talk to Mr. Curtis Lawrence about them. Mr. Curtis Lawrence, now, seeing what the doctor said, it is important to take the context into what we're talking about, the procedures, how they will be implemented, and especially when we talk about the United States, which has been one of the worst hit countries in the world, and the fact that the policies of the federal government, of all the state governments, are so tumultuous. How do you see this being imposed?
Yeah, I mean, when we look at even across the country, and different states are doing different things, and they have different levels of cases each day, where some states are hit much harder than other states. I think one of the things that we really have to look at is to what degree can schools financially implement a lot of the safety guidelines. And so I heard mentioned as well class size, What about temperature checks? And so all of the adults coming into the building have to be temperature checked at my school. The students coming in have to be temperature checked, and they'll be random temperature checks.
The doctor mentioned testing every single week of the staff members, not just temperature checks.
Right, and so as far as what we can do, that's what we're going to do, each day. Of course, when dealing with can we make teachers or make adult staff go get COVID checked regularly? That deals with another thing that schools, at this time at least in the United States and different states, don't have are not the governing body to enforce to make sure you go get checked. If they do show symptoms, though, we do have protocols in place to make sure that we're able to handle that situation at that given time.
Mr. Curtis, Lawrence, just last question from you now. Schools that don't have the funding, that don't have the privileges of many other schools to implement all these procedures and all these guidelines, how do you think that they, for the next school term, can prepare in order to help their students better?
I mean, I think one of the things is definitely going to be how do you look at your budget and how do you manage your money in order to do so. There were funds that the government did give out to school districts and states for such purpose. There are many schools, despite funding, with school leaders and district leaders able to manage that money, able to make certain decisions to get these things done and implemented into the into the school. And so there's funding there that can be tapped into, and I believe that's something that school districts would have to and need to do. There are some school districts also that are looking into delayed school opening, where they're opening a month later or they're opening up 3 weeks later to give them time to move around money and to get the orders in and get the materials in that they need.
Just one last question before we close off. Mr. Lawrence, how much pressure do you feel, and the community, the principals, all the teachers, they feel under the government's pressure to reopen schools, threats of cutting down funding, and many other things that the president routinely states?
Yeah, I mean, I think it's mixed, and depending upon where you go, when you look at the teachers, the staff, principals, as far as the level of pressure that we may feel to open. The community in which we serve is a highly underserved community where many of our families and parents need to go to work or lose their jobs, and so they need the children to come to school. And so that's one pressure, if you will, that some principals may feel we need to serve the community. And as far as like just opening the schools amidst COVID and those things, I think it depends on where you go. I can say where we are, having spoken to the staff and so forth, many of them are not as concerned. They just want their questions answered and want to know what are the safety measures that we have in place. And we've been able to address those safety measures that many of our staff members want.
Right on that point, thank you so much, Mr. Curtis Lawrence, for joining us. And thank you so much, Dr. Jack D. Zinger, for joining us. That we've come to the end of our show with that. We will see you next week with more stories. Till then, goodbye and take care.